Hi, I'm Stormy.
I'm Samantha.
And I'm Stacy.
And today we're presenting our EBP project on how nurses feel while implementing restraints on confused patients.
So our title is To Restrain Causes Pain, and we chose this title because after reviewing our articles, we came to the consensus that these really encompass how the nurse feels after using restraints. They feel a lot of guilt and emotional pain even after they leave their shift after restraining their patients. Our research question is, how do nurses perceive the act of implementing mechanical restraints on confused patients over a 6-month time frame?
So just some background on the use of restraints. They can prevent falls in patients that are to be on bed rest. They can prevent self-removal of endotracheal tubes, IV catheters, and Foley catheters, as well as aid in prevention of harm to staff, visitors, and roommates. When we reviewed the literature, these articles we retrieved were based on qualitative data regarding nurses' attitudes on the use of mechanical restraints on disoriented patients. These patients were typically post-op, intubated, and partially sedated. We have found from the articles and the websites we've reviewed that the overall feelings on restraint use included guilt, uncertainty, and has resulted in ethical dilemmas for these nurses. Deciding between necessity and safety proved to create some emotional trauma for them.
So for our outcome, the nurses interviewed faced difficulties and ethical dilemmas regarding restraint use. They may face uncertainty and distress in choosing between patient safety and autonomy. So many nurses have experienced the moments where they felt uncertainty about their restraint use during their shifts. In one of the articles we reviewed, one nurse explained that she had a patient with a tracheostomy trying to remove it. The patient begged her not to restrain her hands, and the nurse put herself in the patient's shoes and felt that it was a very difficult and painful experience for the patient to have, and the nurse felt guilty. Not considering a patient as a human being and using restraints was really weighing on the nurse. Another nurse had a similar experience. She restrained a restless patient to prevent her from falling off the bed. The nurse had waves of guilt at home after her shift and was preoccupied with the accuracy of her decision. They felt if they spent more time and talked to the patients more, that they might have not had to use restraints. These experiences show how the use of restraints lingers with nurses even past their shift as they question the hard decision of implementing the restraints.
For the recommendations, to avoid this uncertainty and guilt that the nurse may be feeling, we feel that if clearer guidelines were established of when to use restraints, the nurse would have a sense of justification and security for using the restraints, and she or he wouldn't feel so guilty if, say, the patient, didn't like having the restraints on or something of that sort. We also found that in the study, educating patients and families on why the restraints are being used, for example, so the patient doesn't hurt themselves or others, kind of made the nurse feel a little more comfortable because the patients and the family of the patient felt a little more comfortable with having the restraints on. So that made the nurse feel better and less guilty. So we also found that the nurse-to-patient ratio also may affect restraint use, because nurses said that having one patient allowed the nurse to be a little more vigilant with the patient and possibly not need restraints, versus if the nurse had, say, 3 or 4 patients, then the nurse wouldn't be able to spend enough time with those patients and possibly need to restrain them, while just with one patient, the nurse may not need to restrain them.
So this was our EBP project on how nurses feel after restraining their patients, and we hope you gained some insight on that. Thank you.
Thanks for watching.